Yes, ma'am.
We will talk about cranial fossa. See, this is the inner, like suppose this is the skull cap, which is actually also called as calvaria. So when you see the interior, like cranial vault, so when you see the cranial wall, this is the outer table of the skull bone. This side we will have inner table of the skull bone. In between we have diplo. So this view you are seeing the skull cranial wall from inside. So you are finding certain impressions of the blood vessels which are seen covering the brain. Correspondingly here where we have the sagittal suture, when you have seen from the superior aspect, correspondingly where we have groove for superior sagittal sinus. Of course the sagittal suture is also seen. We are finding so many holes so many like depressions over here, which are called as granular foveolae, which are actually produced due to arachnoid granulations, what we see with the meninges. When we do meninges, you will come across arachnoid granulations. Okay. So colors have been used for frontal bone, orange color, parietal blue, and sky blue is the occipital bone, and the same names like bregma, lambda, and all. Okay. So inside, there is in I told you there is a metopic suture in few skulls. Basically, frontal bone is formed by the fusion of two individual frontal bones. Sometimes that suture may remain like that only, which is metopic suture. So correspondingly, inside you have a crest which is called frontal crest. Okay.
Yeah.
So now you see here, inner surface of calvaria, nothing but the cranial wall. It is showing coronal suture, sagittal and lambdoid sutures, sagittal sulcus, superior sagittal sulcus, frontal crest. Just now I have shown you. So frontal crest is an area where you will see the dura mater will be attached. So granular pits we have seen just now, grooves also. Like when we were talking about foramen spinosum, there I have shown you like previously when we were, no, I didn't show you, I will show you today. So we will also see groups. See, can you see these are the groups here? So these are all groups for,
Yes, ma'am.
yeah, meningeal vessels. Okay, like for middle meningeal artery. So we have parietal foraminae correspondingly for with the parietal foramen what we found outside. So which passes the parietal emissory veins, connecting the veins of scalp to the veins of brain, that is the superior sagittal sinus. Now you see this is the skull bone and the outermost covering is the periosteum, innermost covering is endosteum, in between we have the diplo. Now you are finding sickle-shaped fold of dura mater disease, which is actually called as fox cerebri. Within this dural fold, you are finding one vein is there, nothing but you call it as superior sagittal sinus. So this is in like inferior free border of this like fox cerebri. This whole thing is actually called as fox cerebri. You are finding one more sinus, that is the inferior sagittal sinus. Then we have straight sinus and so many other things are there. Whatever is required, I will tell you. Now this is the interior of skull bone and this is basically the posterior cranial fossa. In the posterior cranial fossa, you are finding this is sigmoid sinus actually. The sigmoid sinus will be opening through this opening. What is this opening? Jugular foramen. So the sigmoid sinus is the largest venous channel which is actually collecting
Mm-hmm.
blood from all parts of the brain. Finally, the sigmoid sinus is entering into the jugular foramen. So now you can see this is the skull bone, like this is the outer table, inner table, this is a diplo. So you are finding this green colored area is nothing but the dura mater. So the dura mater will have two layers. This is the endosteal layer and this dark green color is meningeal layer. Between the endosteal layer and meningeal layer only we will have venous blood. Those are nothing but the dural venous sinuses. They will be
Sinuses.
named superior sagittal sinus and all. So this green one is the dura mater, pinkish one is arachnoid matter, orange yellowish one is pia mater. So we have three meningeal layers: dura, arachnoid, and pia. Okay. So between like dura has further two layers, that is the endosteal layer and the meningeal layer. Okay, in between which we have the dural venous sinuses. Now exclusively you are finding parietal bone here, where you are finding like four borders are there, and this picture is helping us to understand the impressions of the blood vessels, vascular grooves which are formed due to certain blood vessels which are supplying brain like middle meningeal artery. Okay.
Right.
Yeah. Now coming to the interior of the base of the skull, now it is divided into three subdivisions: anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Okay. So anterior cranial fossa predominantly it is formed by frontal bone. Okay, we will see in detail with different colors. See, anterior cranial fossa, here yellow color has been used, so maximum part of the yellow color is actually showing the contribution of frontal bone. In the middle you are finding sieve like structure. If you have skull bone with you, just check this. You will have so many holes in the cranial fossa. This area is actually cribriform plate of ethmoid bone. This is a different bone, so this gives passage to the olfactory nerves. Okay, so that is one. Then anterior cranial fossa is also showing a part of sphenoid bone, which is shown in pink color for our convenience here. So that is all anterior cranial fossa. Then so anterior and middle cranial fossa you are finding here. Middle cranial fossa you are finding like sphenoid bone and also the temporal bone, both are participating, of course many other bones. So anterior and middle cranial fossa, posterior border of the, this is posterior border of the lesser wing of the sphenoid bone. Now this area would be sulcus chiasmaticus. Middle cranial fossa and posterior cranial fossa, we are finding this rough area of whole of the orange bone, that is the petrous part of the temporal bone. Okay, and this depression is actually called as dorsum sellae of the sphenoid bone. So we will discuss much in detail now. First, like just look at the labelings which are given here. So in anterior cranial fossa, we have frontal bone, cribriform plate of ethmoid bone. Within the cribriform plate of ethmoid bone, you are finding a pointed area which is called as crista gallae. Crista gallae. Okay, and this is the sphenoid bone. So then you are finding this is the superior orbital fissure at this point we have. Then this is sella turcica area. We have certain holes like foramen ovale, behind which we have foramen spinosum, what we have seen in norma basalis also. One more foramen you are able to see in the cranial cavity, that is foramen rotundum. You can just
Rotarum.
rotundum.
Rotundum. It's rotundum and it has maxillary nerve in it.
Yeah, maxillary division of trigeminal. ROS is the code for you to remember easily. Rotundum, ovale, and spinosum. Okay, this is foramen lacerum. This is like internal acoustic meatus. Then we have jugular foramen. This would be hypoglossal canal. Correspondingly, whatever foramina we saw outside in the basalis, correspondingly we are also finding it inside. Okay, that is. So middle cranial fossa, then we have, see this is foramen magnum. Okay, this is internal occipital crest if you remember. Outside we have external occipital crest. Here I said we have frontal crest, this is the internal occipital crest. Okay, these are actually here correspondingly we have transverse sinus, hence it is called as transverse sulcus. Dural venous sinus name is
Right.
transverse sinus, hence you call it as transverse sulcus. Here we will have sigmoid sulcus because correspondingly we will have sigmoid sinus. This area is like convergence of all dural venous sinuses. Okay, all dural
Yeah.
venous sinuses converging point this is. Okay. Mm.
Yeah.
Yeah, foramen magnum, and yeah, of course. Now see here, like many, like let us see if we have missed anything. So this is frontal bone, and in this frontal bone, these yellow plates are actually forming the roof of the orbit. In norma frontalis, we usually see two orbits, no? So the roof of the orbit is contributed by these plates. You call it as orbital plate of frontal bone. Okay, so orbital plate of the frontal bone, and in the middle we have ethmoid bone, and in the projection we have is crista galli, we have cribriform plate of ethmoid bone. Okay, so this area we have optic chiasma, hence there is a groove formed here which is called as chiasmatic groove. Okay, this area is actually pituitary fossa, where we have pituitary gland which is called as sella turcica. Okay, anteriorly we have tuberculum sellae, posteriorly we have dorsum sellae, tuberculum sellae, dorsum sellae, and in the middle we have sella turcica, where we have pituitary gland. Same will be named here. See, this is tuberculum sellae. Behind you call it as dorsum sellae. In between you call it as hypophyseal fossa. Okay, also called as sella turcica. It is like a saddle what we see at the back of the horse. That's the reason it is named as sella turcica. Okay. Then, so the upper one, like in the anterior cranial fossa, this pinkish area is lesser wing of the sphenoid bone. So this is all lesser wing. Okay, and whatever you see in the middle cranial fossa, this butterfly shaped bone is completely sphenoid only. This particular area we have greater wing of the sphenoid bone. So this means this is the greater wing. Above one is the lesser wing of the sphenoid bone. So between lesser and greater wing, you will have a fissure. You can appreciate if you have bone with you. So that fissure is nothing but superior orbital fissure, which you can see through orbit also. Okay.
Yeah.
And of course, you know this Ross foramen rotundum, ovale, and spinosum. Foramen lacerum also we know internal acoustic meatus, and almost everything we have seen in the previous. And one more thing you have to learn here is we have anterior clinoidal processes, and I'll show you in the this one. With the lesser wing of sphenoid bone, you are finding these projections. No, these projections are called as anterior clinoid process, and behind this point, you call it as posterior clinoid process. Okay, so these
Yes.
projections of the lesser wing, anterior clinoid process. At the petrous part of the temporal bone, what we have here is the posterior clinoidal process. Okay, so rest all words. Optic canal we have seen, it gives passage to optic nerve. If like in norma frontalis we will be able to see more, but if you have the open skull cranial cavity, you can actually pass the probe in this hole, and you will see it will be entering into the skull. Okay, and then foramen. Pause करके. So now let us discuss in detail about this like anterior cranial fossa. So in this anterior cranial fossa, you will see the brain is fixed, right? So this part of the brain is actually the frontal lobes we have here. This is the cribriform plate of ethmoid bone. I already told you this yellow area is orbital plate of the frontal bone. This pinkish area is lesser wing of the sphenoid bone, and this particular area in the middle, it is called as jugum sphenoidale. This middle area is where I'm pointing the arrow is called as jugum sphenoidale.
Jugum sphenoide.
Yeah, jugum sphenoidale. Now this is cribriform plate which you have seen here. This is complete ethmoid bone, Bhavya. So
Yeah, it
cribriform
has
plate,
a crista galli in the
yeah, you
middle.
have this projection crista galli which gives attachment to Fox cerebri. Just now what you have seen, sickle shaped fold of duramen. This actually is forming the nasal septum. That means the cribriform plate is giving the projection which is entering into the middle of the nose. ओपन स्कल भी है, ऐसा खुला वाला नहीं है, देखो ना, लेके आओ ना प्लीज. Are you able to see this, Bhavya? Skull bone in my
Yes,
hand?
ma'am.
Huh. So in the nose, no, you will have, there will be one partition. That partition is
Yeah.
actually this one only. That is perpendicular
Septum.
plate of ethmoid bone. Okay.
Is it
Means
septum?
that means in the cranial fossa you are finding only this much part, that is cribriform plate, whereas in the nose the partition area is nothing but the you call it as perpendicular plate of ethmoid bone, perpendicular plate of ethmoid bone. Okay, so the small apertures whatever you are finding in cribriform plate, it gives passage to olfactory nerves. Okay.
Okay.
Now, if you observe here, there will be one foramen in the anterior aspect which is not always present. If present, it is named as foramen cecum. Okay, anteriorly there will be one foramen in the midline. It's not labeled
It
though.
might be patent, right? It might not be a patent
Yeah,
also.
yeah. So that is foramen cecum. You are seeing like vein from nasal mucosa may pass through it and draining into superior sagittal sinus. Okay. Then so that is number of small olfactory nerves, then crystal. Okay. This is orbit you are finding, the same orbit what you have in my hand also. Now this orbit is left orbit, like what I am showing you on the screen. So here you are finding certain ethmoidal foraminae also, anterior, posterior, not so important, you can just ignore. No. Now this is the cranial fossae. So in the cribriform plate of ethmoid bone, what are passing? I said olfactory
Cribriform is
nerves.
the olfactory nerve. Olfactory nerve is the first cranial nerve.
Yeah,
Yeah, I think
olfactory
so.
is the first cranial nerve and it is continuing to form the olfactory bulb which continues as olfactory tract.
Optic.
This is optic
Yeah,
canal.
then canal. Yeah.
Yeah, optic canal gives passage to second cranial nerve.
Optic canal. Optic nerve is the second cranial nerve. And optic canal is with the, is it with the optic chiasma? I'm not so sure. Optic chiasma is a little in front near the
Yeah.
jugum,
Hmm. Yeah,
the
this is area
sphenoidal.
superior orbital fissure, right? So
Yeah,
superior orbital fissure gives passage to many structures. What are those? Ophthalmic division of
LFT.
trigeminal. Then
Yeah, there's LFT in the front, in the first or the anterior compartment. Then there's O and O in the second
oculomotor.
compartment.
Listen, Bhavya, you have the
Yeah.
concepts, it becomes easy for you. You remember like third, fourth, fifth, sixth. Individual bones है, तो fetal skull भी है अपने पास. ऐसा खुला वाला नहीं है मुझे, खुला वाला. ये कैप निकाला हुआ रहता देखिए. So in the superior orbital fissure, third, fourth, fifth, sixth, you remember. Third is oculomotor, fourth trochlear, fifth trigeminal, only ophthalmic division of trigeminal passes through the
Okay.
superior orbital fissure, and sixth is
Third,
abduction.
fourth, fifth.
Third, fourth, fifth, and sixth. Sixth also.
So oculomotor, trochlear, ophthalmic of the trigeminal. Lastly, sixth is
Abducent.
abducent.
Abducent. Okay. Okay, then sixth is done, right? Then seventh and eighth, they are passing through internal acoustic meatus. Seventh is facial, eighth is vestibulocochlear. Okay. Ninth, 10th, 11th, they pass through jugular foramen. And 12th one is passing through hypoglossal canal.
Hypoglossal canal behind,
Yeah.
near the foramen magnum.
So 11th one, no, accessory, it has cranial part and spinal part. The spinal part is actually coming from the spinal cord. Again, it is also entering into this jugular foramen only. Okay. So now coming to the anterior cranial fossa, you have this is orbital plate of frontal bone which is convex. Forms the this is the roof of the orbit. So the roof of the orbit is actually contributed by the orbital plate of frontal bone. Okay. So you can see it is articulating behind with the lesser wing of sphenoid bone. This is jugum sphenoidal, already I told you. So lesser wing of the sphenoid bone is like concave. Okay. Then these projections, what are they called as? Medial end of the posterior margin, we call it as anterior clinoid process. And पूरा एक साथ उठाओ. Now this is middle cranial fossa. I already told you this is the sella turcica.
Sella
Also called
turcica,
as
and then there's a
hypophyseal.
dorsum turcica.
Where what do we have?
Sorry, so
Pituitary
dorsum
gland.
sella.
Uh,
Huh? Yeah, hypophyseal fossa. Then there's a tuberculum of sella, and then there's a dorsum sella. And the
tuberculum
middle,
sellae, dorsum sellae.
yeah,
This
and then
point
dorsum
you will have
sellae.
temporal lobe of brain on each side. That side.
Yeah, and then dorsum sellae has a clinoid, posterior clinoid.
Posterior clinoid processes. This is anterior and this point. Yeah, posterior clinoid processes. So in the median part, upper surface, this is the body of the sphenoid bone. It is like a butterfly sphenoid bone, isn't it? So it presents the sulcus chiasmaticus in front, sella turcica behind. Okay, carotid groove will be here on either side, this one, because internal carotid artery comes here. Okay, so this is optic canal which is passing inside. Okay, it gives passage to not only optic nerve but also ophthalmic artery. Okay, then sella turcica, it is, you already know, like it's like a saddle. So that is hypophyseal fossa, everything we have discussed. So this is tuberculum sellae. So foramen ovale, you can see foramen spinosum. The posterior clinoid process is so clearly shown. It's a part of sphenoid bone only. Okay. So on either side of the dorsum sellae, tuberculum sellae, dorsum sellae, sella turcica. This is the posterior clinoid process. Okay. This is the optic groove. Okay. Lesser wing, greater wing.
There's also foramina versalis, right?
Which one?
Foramina versalis. Or versalis, one of them.
Yeah, vesalius. Yeah, it is there, but it's not so clearly visible. We will discuss. You can see how this internal carotid artery is grooving. Passes through like carotid canal, then foramen lacerum, and then it comes to lie on either side of sella turcica. Okay. This is hypophyseal fossa. It also forms the floor of, suppose if you break this bone, you will see inside empty space, that is the sphenoidal air sinus. Okay.
Where?
Here in the middle cranial fossa, where you have pituitary gland, this area.
Hypophyseal fossa.
In the hypophyseal fossa, it will be like a box only. So if you just chip it out, you will find empty space below this. That is nothing but sphenoidal air sinus.
Sphenoidal air sinus.
Like you have
the frontal air sinus.
In the frontal bone, you have frontal air sinus. No, similarly in the sphenoid bone, we will have sphenoidal air sinus. Okay.
Okay.
So this is dorsum sellae, and these are the posterior clinoidal processes. Okay. On either side, this particular area is carotid groove, which is lodging internal carotid artery. So these are the folds of dura mater, like falx cerebri. We will discuss in a separate class, tentorium cerebelli. These are all dural venous sinuses associated with these folds of dura mater. This is sigmoid sulcus where we have sigmoid sinus. This is transverse sulcus where we have transverse sinus. This is confluence of sinuses. That means all sinuses meeting point. at internal occipital protuberance, this point correspondingly. Now, on the lateral parts of this middle cranial fossa, you are finding this greater wing of
Temporal.
the sphenoid
Oh,
bone.
okay.
You are finding superior orbital fissure, Ross, rotundum, ovale, and spinosum, these foramina. Okay. So superior, मुझे एक झाड़ू की कौड़ी करना। So superior orbital fissure you can see through orbit also. So you can see here like it is present between the lesser and greater wing of the sphenoid bone. Okay. So like below and so that is the superior orbital fissure, and these are the structures which are passing through. So when you talk about,
That's the cartilaginous ring of
huh?
Zinn, sorry. Is that the cartilaginous ring of Zinn?
This is common tendinous ring of Zinn, which you will be studying when we do extraocular muscles. Okay, so many structures pass. So like it is like common tendinous ring will be actually dividing it into lateral part, intermediate part, and the medial part. Okay, so like this
Yeah.
is the tendinous ring. So medial most area we have the passage for inferior ophthalmic vein. In the middle part, all this abducent nerve, then oculomotor nerve, inferior and superior divisions. Nasociliary nerve is a branch of ophthalmic division of trigeminal. So you have the lateral part, trochlear nerve, superior ophthalmic vein, frontal nerve, and lacrimal. You were trying to recollect LFT, right? So lacrimal, frontal are the branches of ophthalmic division of trigeminal. Even nasociliary is also a branch of ophthalmic division of trigeminal. Okay. So like this, if you just practice this diagram, you will write in your own words. So foramen rotundum, already I told you, like it is giving passage to maxillary division of trigeminal nerve. So from norma basalis, we usually don't see foramen rotundum because it is obliterated. It is just opening in the pterygopalatine fossa. Okay, that is the reason you don't see it from down. All these are not required. So this is the passage of internal carotid artery. It's journey
Right.
from the
That's the carotid canal, right?
carotid canal to the foramen lacerum. Carotid
Yeah.
canal, like its course forwards medially, and it is directed towards the carotid, like foramen lacerum, and then it is seen on either side of sella turcica. Okay.
Yeah.
This is internal acoustic meatus where you have vestibulocochlear and facial nerves, isn't it? This is the
Yeah.
internal ear outline which has been shown. Semicircular canals, cochlea. Okay.
Okay.
Now coming to posterior cranial fossa. So roof of posterior cranial fossa is formed by a fold of dura mater which is tentorium cerebelli. This one, tent. You just remove this tent, we will be able to see the posterior cranial fossa. So the tentorium cerebelli is attached along these margins, nothing but the lips of the transverse sulcus. Okay. So this area is clivus. This one, clivus area, where you will see like brain stem will be resting and it will enter into foramen magnum and it will continue as spinal cord. So this area is clivus. Okay.
Okay.
So this is clivus area. Fusion of this basi-occiput body of sphenoid bone. So it is related to brain
Basi
stem.
occiput is basically the clivus on the outside, right?
Here also we will see corresponding. This area is also basi-occiput only. From outside this area, pharyngeal tubercle, what I have told you previously, that is also basi-occiput only. Correspondingly inside also same thing. Okay. Basi-occiput body of sphenoid bone. So here, what is resting?
So then what is clivus and then what is basi-occiput over here?
Basi-occiput is basically, it is named from outside. Clivus is this sloping area. This sloping area is
Okay.
clivus, where you will
Then where
have
is basi?
basi-occiput is this. If you have studied, I have shown you in front of
Yeah, that's
occipital
what I'm saying,
condyles.
right? Clivus is basically the basi-occiput on the inside.
Basi-occiput on the inside. Understood?
Yeah.
Okay, so what do we have here? Brainstem. So pons medulla oblongata. Okay, so at this point, when we do the blood supply of brain, we will also come across basilar artery. Here we also see basilar venous plexus. Okay. Now you can see here. So this is the basilar. This whole area is clivus only. This is anterior cranial fossa. This is middle cranial fossa. This is posterior cranial fossa. So in the clivus area, you are finding basilar artery, vertebral arteries. Here brainstem has been removed and the spinal cord is cut over here. So the brainstem continues as spinal cord. Okay. So anyhow, when we do like dural venous sinuses, we will come across all these points, but I have shown you sigmoid sulcus, internal occipital protuberance. Confluence of venous sinuses is also called as tuberculum hierophili. Okay. So cranial nerves, from where they are coming, we have already discussed. So that is all about cranial. Checking if any new good diagrams are here.
Okay.
This is from Netter's Atlas. You can use Netter's Atlas while
Okay.
studying. It's very useful.
I'll try and find it. My dad said that we had it, but then I don't know where it is.
Okay, okay. Try reading with the help of Atlas. You will really understand very well.
Okay,
So how
ma'am.
nicely it is shown, like skull cap is removed and you are now seeing this view, that is the cranial cavity. So in this though, like what are the foraminae, what are the structures causing? We have discussed anyhow, but still. This is fetal skull. I have in my hand also fetal skull. Small skull. We have discussed when we were doing verticalis. Anterior frontanelli, posterior frontanelli, sphenoid frontanel, mastoid frontanel. Okay.